Hello, welcome. My name is Jody Skulls, and I'm your instructor for the MBLEx review course. I'm so excited to be here today. If you're seeing this and you're outside of the patron community, because once every 2 weeks, I will post a free video on YouTube. So if you're watching that, know that hop into our patron community and look at how many people have passed. It is so exciting. Oh, it just fills my heart with joy to be able to facilitate this space for you, which is a classroom, an online classroom, where we study specifically how to prepare for the massage and bodywork licensing exam. And I do my classes in 3 parts. And those 3 parts are, number 1, I give you some strategies. So some strategies that you can apply when you're taking the test, because reminder, it's not just about what you know. There has to be a strategy to taking this test. So today, we're going to talk about the strategy of understanding the computer adaptive test. So we're going to talk about that strategy, the computer adaptive test. What is that? It's the type of test that the MBLEx is. But in part 2 today of class, we do our big learning. And today we're talking about anatomy. And as you will see, as graduates share when they pass the MBLEx, they are sharing over and over again how little anatomy is actually on the test. Yeah. 11 questions on anatomy and physiology. 12 questions on, plus or minus, on pathology. So we look at that and we know that over 30 questions are going to be on something unrelated to anatomy, but we still need to know anatomy. So today in part 2, we are talking about the upper body, some upper body stuff. And then in part 3, we're going to dissect some questions. Yes, we are going to learn how to approach these questions. By the way, more and more people who are taking the MBLEx are telling us there are many more questions, many more times that they're seeing a question with only 3 answers. Yeah, today all of our questions have 4 answers, and that's traditionally what you'll see on the MBLEx, but seeing it more and more. Yeah, there's only 3. So in the very first part of class today, I like to give you a strategy for a few minutes about taking the test. And today we're going to talk about the computer adaptive test. In the patron site, I will link the 4-minute video that the Federation has produced. So the person, the people, the organization that facilitates the test, the MBLEx, is called the Federation of State Massage Therapy Boards. That's where you go to apply to take your test, the FSMTB. And they produced a video that talked about the computer adaptive test. This test is designed to give you, your very first question will be on a scale of 1 to 10, or let's say a scale of 1 to 5. A scale of 1 to 5, your first question will be about a 3 in difficulty. If you get that question right, the computer will adapt and give you a harder question next. Did you know that? So if you think the test got harder as you went along, you were probably right. Yeah. So the computer adaptive test actually reflects whether you get an answer right or wrong. Now, on your first question in a category, you may get the question wrong. If you do, the question will get easier. The next question in that category will get easier. Now, Each question also has a different weight of points. So the harder questions are worth more points, the easier questions are worth less points. And your goal is to score 630 points in this 100 question test. 630 points in this 100 question test. You'll have 2 hours, really about an hour and 15 minutes from when you get started. You're actually seeing test questions. There's some other stuff you need to do in there. But just know that as you take the test, if you are getting more difficult questions, it's actually a good sign. Yeah, it's a good sign because it means you're answering questions correctly. Also, the harder questions are worth more. And so, when you are answering these questions, you got to prove competency in all of the 7 categories, but you get a chance to do that in different ways. And so, in some ways, people feel like, oh, the test is working against me, but it's not. It's actually working for you. So, let's see. It actually is working for you. Therefore, celebrate a little if you get a tough question. For real. Because that just means that you've done well in this category so far. Yes. And what you're looking to do is prove competency through all of the categories using this computer adaptive model. So that is the bigger picture of what the MBLEx is about. So when you sit down, it's not just going to be 100 random questions. It's not just going to be 11 questions in anatomy. It's going to be 11 questions that vary back and forth between difficult and easier. So just understand that as you're going through the test, if you're feeling that feeling of feeling anxious or nervous, or that's actually good for you. It's a good reminder to breathe. Because you will see some questions you have never seen before, have no idea what they're talking about on the MBLEx, for real. And I know, I'm sorry to say that. I wish you could, some people think, oh, I'll just memorize all these questions. Doesn't work that way. Nobody has the questions. The practice exams you take with me, those are great replicas, great examples of the style of question that you're going to get, but those aren't the questions you're going to get. Yeah. So that is my strategy and insight for you today on strategies for actually taking the MBLEx. It's now time to move into part 2 of our class, and that is to go ahead and do some learning. Good. All right, let's move along here, and I will share my screen. So welcome back. Welcome back to the MBLEx review course. Today we are going to be talking about, I'm Jody Scholes. I'm your instructor. I don't know if I said that yet. I'm Jody Scholes. I'm your instructor for the course. And today we're doing an introduction to upper limb and upper body, some anatomy. We're not going to cover it all, but I want to say a little shout out to SlideShare. I'm a member of SlideShare through Scribd, C-R-I-B-D, no E in there. And they are very helpful in helping me to craft my slides for you. So let's first take a look and jump right in on what we're talking about. Okay, this is the anatomy of your upper body, your thorax, your shoulder region, neck. That's where we're going to be focused on, what we're going to be focused on today. So here in kind of section A, you'll see the neck with 7 cervical vertebrae, 7 cervical vertebrae in the neck. We move out here to our clavicle and our sternum. So collarbone, clavicle, same name, same thing. And then the sternum. The sternum is in 3 parts. Here we see the manubrium identified. But as we move out here, I want to just do a general anatomy now, okay? Here's our shoulder joint. Here is the long bone of the arm. We're going to get into the scientific names of these in just a minute. The long bone of the arm, our elbow joint, forearm, wrist, and hand. Here you'll see a view from the top looking down. And this is our clavicle right here. And you can see the spinous process of the vertebrae. Here in this image, we see the transverse process of the vertebrae. Here we see the spinous process of the vertebrae. We see some ribs, and we see the thoracic wall. We see some muscles. We're going to get more detailed on this in just a minute. Wanted to give you the general region we'll be covering today. All right. So I just realized too that I need to move me out of the way. Ooh. There we go. So we're going to be talking at first about the upper limb. And this upper limb is also associated with the lateral aspect and the lower portion of the neck. The arm is suspended through the shoulder joint. And this upper body also includes the skeletal articulation, as it says here, between the sternum and the clavicle. So we need to know those general regions, and that's where our muscles are going to be layered on top. So as you see, the upper arm has been divided into, the upper limb has been divided into the arm, the forearm, the hand, and the wrist. Remember, it's an arm, but it's an upper arm, upper limb, an upper arm, shoulder, arm, forearm, wrist, hand, as you saw in our image. Shoulder, arm, forearm is considered between the elbow joint and the wrist joint. Hand is distal to the wrist. We have a couple other regions we want to notate. The axilla region. The axilla region. Do you remember what the axilla is? In the chat, axilla region. The axilla region in that area of the body. Do you remember? We're going to move down here while you guys get a chance to answer. The cubital fossa, the cubital region, is the elbow region. And this is the carpal region, the carpal tunnel. The carpal tunnel is formed by a band of tissue called the transverse ligament. You can see that here at the distal end of the forearm. The transverse ligament is represented by that yellow mark here on the distal end of the arm. And that ligament forms kind of like a bridge. Underneath it live the carpal bones. It creates kind of a carpal tunnel, therefore the name. Oh, the axilla, cubital. Did anyone answer that? Okay, let me see the answers. Yes, the armpit. Yes, Kenya. Yes, Melissa. The axilla region is the armpit region. So the axilla region, let's go here, cubital fossa, the carpal tunnel, because they're significant areas because they're transition areas of the limb. So where a lot of our muscles and our ligaments attach. So important structures pass through there or related to these areas. Let's take a quick look at another area that we haven't covered before, and that's the brachial plexus. The brachial plexus technically is on both our left and right sides, but let's take a look here. It is the nerve bundle that passes under the clavicle and is responsible for innervating our arm and hand. Sometimes we'll feel a ping, a zap, a shock, and that can be when this brachial plexus is being impinged, like pinch, impinged upon. That can happen from tightening muscles, can happen from, say, for example, the pectoralis minor being tight and putting pressure on that nerve bundle. It can also, the brachial plexus can start acting up, can start causing pain and numbness if we have a forward shoulder position. That forward shoulder position can place weight, pressure on those nerve endings and start creating some numbness, tingling, or that feeling of being zapped. Here's another image of the brachial plexus. And so with minor injuries, you can feel kind of a stinger. Football, rugby, soccer. But here's another nice look at how that brachial plexus comes down under the clavicle, under pec minor, and flows through there. There are other things that affect the brachial plexus. If someone's having pain down their arm, it can be a host of things. But if it's affecting the brachial plexus, there are pathologies of the brachial plexus. Some people get cancer in that area. Some people have tumors. That can put pressure there. That's not where we jump to. We deal with the musculoskeletal issues, and you will be tested on the musculoskeletal issues of the brachial axis, of brachial plexus. Sometimes from biking in doing triathlons, when I would do triathlons, we would spend hours in this position. And that, again, caves in the chest and can put pressure on that brachial plexus. Let's go through the anatomical landmarks of the shoulder, the upper limb. So the shoulder attaches to the trunk. We've got the clavicle. We've got a scapula, the shoulder blade, and that forms the pectoral girdle, or our shoulder girdle. So this region, the collarbone and the scapula, form that shoulder girdle. Much like we have a pelvic basin, we have a shoulder girdle. And this is considered the proximal end of the humerus. So the upper part, proximal versus distal, right? Proximal versus distal, proximal end of the humerus. So we'll see a picture of the trap and the delt. So the trap, is that triangular muscle in the back. The delt, we have three of them, anterior, medial, and posterior. These muscles all connect to scapula, clavicle, trunk, arm, and we'll see how those interact. But the superficial muscles of the shoulder are the trapezius and the deltoid. Let's take a look at a picture of those. Hopefully you can see this guy is moving. I don't know if he'll be moving in the video, in the recorded video, but he's moving here. Hey, stop. Hey. Whoa. I thought I could make him stop. I'm sorry. Well, you'll see the areas of the trapezius. You'll see this orange, this red layer is the trapezius. Oh, I get this guy to stop. Oh, wait, here. Oh, that's my PowerPoint. All right, technology is my friend. I'll just talk while he's moving. So the yellow layer, the gold layer would be considered a part of the trapezius here. We also have some areas that are just lateral to that, which would be levator scapula. But what you're seeing is a big old picture of the trapezius. It's a large muscle. We have the upper fibers, the middle fibers, and the lower fibers. Here is our trap. Here's our clavicle. We're looking obviously at a lateral view of this skeleton. Here's our deltoid with the posterior fibers, the medial fibers, the anterior fibers. And just so you know, if you are having anterior delt pain, so right here in that little region, very common. And in fact, many of your clients will seek massage because they have pain right here when they go to reach for something or they go to reach for something. You can treat the anterior delt, but please also treat the subscapularis. The subscapularis is the muscle that is mostly responsible for creating the situation that causes the anterior delt to overwork. So the scapula stops sliding and the anterior delt actually has to pick up the slack. So get in there and work that subscapularis. If you're not sure how to do it, just ping me and I'll send you a little video. Ooh, juicy lateral neck. Beautiful, beautiful picture. The sternocleidomastoid muscle. So it represents, this name represents all the areas of attachment. So it actually comes down here and attaches to the sternum and comes up here and touches on the mastoid. So we'll see another picture of that in a minute, but if you want to find it on yourself, turn your head. And you see this little muscle that pops out here? That's actually your SCM, your sternocleidomastoid muscle. Here's a lovely peeled away image of the levator scap, the upper fibers of the trapezius. We've got a medial scalene in here. Here's the levator. We'll see another picture of that later, peeled away. Our medial scalenes are in here, and our anterior scalenes are in here. Yes, good areas to work. All that area is lovely to work with your clients. Feels so nice to release those muscles. Remember, we focus a lot on the posterior compartment of the neck, right? Do a lot of that. But remember those lateral aspects of the neck and even the front aspects of the neck. They're so lovely to work to balance. So if you're going to spend a lot of time working the back part of the neck, go ahead and remember to work that SCM to balance them off. Again, client assessment, reassessment, and treatment planning, that would be a type of question you might get. If you're working a lot on the traps and the occiput, remember we're going to balance by working the anterior and the posterior. Here's another example of that SCM right here. And let's take a look. You guys could go ahead and just double check that your microphones are muted. That would be really helpful. Thanks. So find your SCM. It's the most superficial and largest muscle of the neck. You'll see here, it's from the Latin words, the chest, the word sternum, chest, clavicle, and mastoid. Yes. And this is milking it is a very effective technique. Try that on yourself. Milking the SCM. Remember to do both sides. All right, let's leave those muscles for a moment and start to peel back the muscles and look at the bones. We're going to look at the bones in relationship to what muscles are attached to them. So the clavicle is right here, and it is your only attachment. It's your only connection between the trunk, the sternum, and the upper limb. So you can palpate it. It has a sternal or medial side, and then it has a lateral side. And where the clavicle articulates with the sternum is called your manubrium. Yeah. or your SC joint, your sternoclavicle joint. That part of your sternum is the manubrium. Staying with me? Yay, good. So we'll see a picture of this in just a moment. Its lateral end is flat. So the clavicle has a little flat spot on the end of it where it articulates with the shoulder, with the humerus. And so the clavicle articulates with the humerus to create the AC joint. So the acromion, clavicle, AC joint. And it's good to know that this is a little bit of an S, but I mean, I don't think you'll be tested on that. Let's take a peek at this. So here's what we're talking about. The sternum, here's where the clavicle, the SC joint, clavicle comes out, and we've got the AC joint right here. Yep, AC, clavicle, okay? So what I want to be clear on is that this acromion is actually not part of the humerus. My mistake. Said it was part of the humerus? It is not. Do you know what it's a part of? Can you see what it's a part of right here? The acromion, the AC joint. You've heard maybe of a pathology where they've dislocated their AC joint. Yes, it's the clavicle and the acromion. Not seeing anyone put it in the chat, but the acromion is the upper part of the scapula. I know, crazy. Look, it pops out right here. This is actually the scapula. It's a part of the scapula. Good. All right. So let's take a look at that scapula, huh? All right. So it's that triangular muscle. You can see here. This is a highlighted picture of the scapula. We'll see more of these in a moment. It makes kind of a triangle. And it covers the 2nd to 7th ribs. Look again here. Rib number 2, rib number 1. See how high up the rib number 1 is? And sometimes, maybe if you've taken yoga or you've done breath work, they will say, go ahead and take an inhale. Go ahead and inhale right now, wherever you are. Inhale in, fill up your lungs, fill it up right to the 1st rib. All the way up. Yeah. And when you're ready, exhale all the way out. So that 1st rib is there. The scapula takes ribs 2 through 7 on most people. And where that scapula glides against the ribs is called a joint. There is no joint there. It's gliding, not in the joints that we've learned about, right? Like our joints that move, our hinge joints, our saddle joints, our ball and socket joints. The shoulder is a ball and socket joint. But that scapula is gliding against those ribs, and it's called the scapulothoracic joint. And we'll see that word written out in a minute. So we have 3 angles, a lateral, superior, and inferior. We have 3 borders, superior, lateral, and medial. So pay attention to what the question is asking. Are they talking about an angle, or are they saying border? The scapula has 2 surfaces, top and bottom, anterior and posterior. So there's a costal surface. Remember, costal also refers to intercostal muscles. Do you remember where the intercostal muscles are? They're in between our ribs. Our costals are also known as ribs. So there's a costal version, costal side of the scapula, and then anterior and posterior. So just be careful of what they're asking you for. And it's worth pointing out, let me just show you on the image here. The posterior side of the scapula could also be called the dorsal side. So like a dorsal fin, it's this side. Slap yourself on the back. Give yourself a pat on the back. Don't slap yourself. Give yourself a pat on the back. That's the posterior side of the scapula. If you pat yourself on the back. After, post, if you do something well, post the event, you can pat yourself on the back. The anterior angle, the anterior surface, is the one that is the costal surface. So again, look at our picture. The anterior surface, because remember, anatomical position is facing forward. The anterior surface glides against the ribs, sometimes called the costal surface. All right. And we have three processes on the scapula: the acromion process, the spinal process, and the coracoid process. So good to know where they are. We're going to highlight all of them. All right. This writing is a little small, so I'm going to put on my glasses. All right. So the better place to see that right here. All right. So here's the spine of the scapula. So in your opinion, what side of the body is this scapula on? I'm going to move to make sure it's not to say. Yep. All right. So this scapula that you're looking at, is it on the left or the right side? Because you might see a picture on your test. Keep looking. Where is going to be the medial border of this? So the medial border will give you the clue. The medial border is the one that's closest to the spine, right? This can be confusing. I know it seems like pretty straightforward, but really it can be confusing. So this image right here is the one I'm talking about. So image A, is that the left or right scapula? I see some answers. It is. It's the right side. It's the right side. You know how you can tell? Right here, the medial border. This is where the spine would be. So if the spine is here, this is the lateral border. You can touch the lateral. If you bring your arm up into a 90-degree angle, you can touch the lateral border of your scapula. Yes, this is the lateral border. So if you're seeing a picture of this, yes, on this image A, we're talking about right hand or right-sided scapula. All right, let's point out a few of the bony landmarks here. So here, right in here, that's not what I want to show you. This is where the supraspinatus lives. We have 4 rotator cuffs, right? Supraspinatus, infraspinatus, subscapularis, and teres minor. Do you remember the acronym? Put the acronym. What is the acronym for the rotators? Do you remember? Oh, yes, Ainsley's sharp on it. Anybody else get it? All right. So here is the area where the supraspinatus lives, right here, supra above, right? Here, right under the spine of the scap, that's where the infraspinatus lives. So fossa just means divot. It means like a cave, technically. In Latin, it means cave. But it means like an indentation. And it gives it a little home. So the infraspinatus lives right in here in this infraspinatus fossa, right in here. Supra, infra. And then we'll show you a picture of the teres later. Teres minor and subscapularis. Look at this. Look what we find here. The subscapular fossa. In here, this is the anterior view of your scapula. So if I could look straight through your rib cage, if I could look straight through your rib cage, I would be seeing this flat part. It's not actually flat, it's a little tiny curved. And that's why it's called the subscapular fossa. There's a little indentation there. It hugs onto your ribs. And that's where the subscapularis lives. So subscapularis, and we'll see where teres lives in a bit. Another thing I want to just point out here is the glenoid cavity. The glenoid cavity is a part of the scapula, and it's the socket for the ball and socket. So the cavity is the home for the ball and socket joint. Humerus, right, long bone of the upper arm, goes into this glenoid cavity. Now this looks a lot different than the hip, right? Because we've got the acetabulum, that round place where the head of the femur goes into the acetabulum, and it is tight, right? It is sucked on in there. We got all sorts of thick muscles that hold that in. The shoulder is much more open, much easier to separate, because the glenoid cavity isn't even really like a whole, like it doesn't go all the way around. It's mostly the muscles that keep the shoulders in place. So when I just identify the borders for you, so the medial border here, you see here, medial border, the lateral border, lateral, right? It's a little tricky because we're changing angles here. Look at it on this side. Here's the lateral border on this side. Closest to your elbow, out here. So if you pick up your elbow, lateral border. And then we have a couple of angles, which are pretty easy to identify. The superior angle, the inferior angle. And that helps to let us know what direction the scapula is moving. All right, moving along. We've talked about the thick projecting spine of the scap, and that it continues to become that acromion that articulates with the clavicle. So that's where it articulates here. Can't quite see it, but this spine comes around, and then articulate just means glides. So our joints articulate, and it articulates, it talks to, it plays nice with the clavicle there. All right, some other images that you may see as a part of your test. The costal, this should say not coastal, costal surface of the ribs. This is the rib side, the front side, and this is the posterior surface. Good. Let's just take a quick peek at those rotator cuff muscles. They live right here. So I'm showing you a anterior view as well, because it's easiest to get to the subscap from the anterior. But let's take a look at the others. Supraspinatus lives in just above above that spine of the scap. Infraspinatus. And then the teres minor is right here. I almost always have to go in laterally to get to the teres minor. So, putting a thumb on it is not easy. You can find the scap, the spine of the scap. Just below it is infra, but lateral, and you see how it's like right out here. And you'll know when you find it, because it hurts. And then on the inside, this is the subscapularis muscle. And so easiest way to get to it, go ahead and try palpating it on yourself. Bring your arm to 90 degrees and basically stick your fingers onto straight line, right? Straight line, as if you're pointing your fingers straight back. And you'll be able to feel some tenderness there. That is your subscapularis. Da-da-da. All right, we've reviewed the angles and the borders of the scapula. The medial, I just want to point out that the medial border of the scap is the vertebral border. Sometimes they'll mix that name up for you. So the vertebral border is that part of the scapula that's closest to the vertebrae. And Again, take a closer look here. This right here, man, boys and girls, ladies and gentlemen, is the acromion process. It is part of the scapula. Just want to be super clear with you. This little part, right here, touches with the clavicle. This also forms part of, this is the glenoid fossa, but this is the glenoid cavity. So that whole thing makes up the glenoid cavity. This is the head of the humerus, head of the long bone here. And let me see if I can remember what that's called. It'll come back to me. The stuff that covers the top of it, it'll come back to me. But yeah, and that's actually what we're working with. The fascia is what we're working with when we are mobilizing a shoulder, is we're warming up this fascia that's right here. The glenoid fossa. It's actually glenoid fossa. The fossa is really in here. And remember, fossa just is that another nice name for a cavity, an indentation, a cave. Yeah. Let's take a quick look at the humerus. We've got some time. I think we're going to have to jump to our questions, though. Here is the humerus. So long bone of the upper arm. We've got the head, the greater tubercle. We talk about tubercles because they're bony landmarks, places for bony landmarks. Here's the distal end, and that's going to form your elbow. The largest bone in the upper body. Here's where it articulates. It's got a proximal and a distal end. And like I said, greater and lesser tubercle. If you're getting questions that say greater and lesser tubercle, celebrate. Because for real, it's where muscles attach, where ligaments attach, and it is a more difficult question. So there are greater and lesser tubercles. Those are prominent landmarks. They're at the proximal end, and they serve as attachment points for the rotator cuffs. Good to know, right? Yeah. All right, we see greater tubercle. Yep. I don't think we have a picture of the lesser tubercle. Oh, there it is, yep. Right in there, but you can't really see how it sticks out. We have a greater tubercle and a lesser tubercle of the femur as well. And so the greater tubercle of the femur is on the outside of the femur, long bone of the leg, just jumping this in here, throwing this in here, is on the hips, right? It's on the lateral side. So you can feel your greater tubercle here of your hip. It's a nice bony landmark. The IT band attaches there. But I point that out to tell you you have a lesser tubercle. A lesser tubercle of the femur. Why do you care? Because the psoas attaches to the lesser tubercle of the femur. Right? Lesser tubercle of the femur is actually on the inside of your leg. It's also the spot where some of your groin muscles attach, near there. But what's important about the lesser tubercle of the femur is the psoas. All right, we'll do lower body another time, but I wanted to throw that in there. We have a great understanding of the humerus. There's a shaft of the humerus. There's condyles. The capitulum and the trochlea. Yeah, those are the two, articulate with the two bones. That's the articulation points of the distal end of the humerus. So what are the two bones of the forearm? Do you remember? What are the two bones of the forearm? Thank you. Yes, the radius and the ulna. Let's take a look. Here we go. So here are the condyles at the distal end of the humerus and the two bones of the forearm, the radius and the ulna. Yay, good. Welcome, Professor Pottery. Thanks, Lauren, for the original answer. Yes. All right. So we've got these condyles that articulate. And so if you see the words capitulum, if you see the words trochlea, you know they're talking about the elbow. It's in the arm. You can usually eliminate wrong answers from knowing your basic anatomy. So the capitulum articulates with the radius, and the trochlea articulates with the ulna. So I like to remember that because trochlea ends with an A, ulna ends with an A. Some of this stuff you just got to memorize. You know, it's the medial side in anatomical position. Woo! I'm throwing all sorts of terms at you. So if you're in anatomical position, that's where you got to get to know articulations, because every movement that you're going to be asked about starts from anatomical position. That's where we have to decide what movement is happening. And so the trochlea articulates with the forearm, with the ulna, on the medial aspect. Capitulum, lateral aspect. So thumb side is lateral. Yes, good. All right, so just know if you see capitulum or trochlea, they're talking about the elbow. Good work, yay! Are you ready to dissect some questions? Are you ready? Are you ready? Let's see. Yay, yes. I'm just gonna make sure those questions are ready for us, and then I'm on the right spot. All right, I guess we can do these questions. I made other questions for you. Okay, let me grab those other questions. All right, we'll just skip down to slide 58 when we're ready. Oh, you know what? Let's just start there, because you've heard these questions. If you saw the other upper body video, then you will know these questions. So we're gonna do this a different way. All right, we're ready. Ready to start dissecting some questions. Oh, the other way to remember, I'll stick with dissecting questions. The major nerve plexus to the upper limbs is the blank. Read through the answers. The major nerve plexus to the upper limbs is the blank. So, seeing some answers. Can you eliminate one wrong answer? If you were going to pick one of those that you know for sure is wrong, you can eliminate one wrong answer. Let's take a look. The spinal nerves. Spinal nerves don't really have to do with the upper limbs, per se. It's a very specific question. Yes, eliminate letter D. Good. Yes, Kenya. Oh, Tanya's in the house with an answer. Let's see. Yep, good. You caught it, Ensley. You caught it. Good. All right, let's see the answer. Ba-bum. The brachial plexus. Remember that brachial plexus? I think I put a picture in here. I didn't. It's at the end. But those nerves that go under the clavicle, under the pec minor, and send all of our nerve and feelings out to our hands, to our arm, upper limb, lower forearm, and hand. That's where all the nerves for our arm goes through that brachial plexus. Yep. Okay. There are some changes happening to the MBLEx. Every now and then you'll see a picture. And this is a picture of what muscle? Is it A, the external obliques, B, the intercostal muscles, C, serratus anterior, or D, rectus abdominis? Can you know you can eliminate one wrong answer, right? What would it be? It's not rectus abdominis, right? I mean, if you've ever been to the gym, you've seen probably, or you've ever been in a, if your school had pictures of muscles on the wall, rectus abdominis right down the middle. And so let's see what you think it is. Eliminate rectus, that's right. Ooh, You guys, you got it right. It is serratus. Woo, I thought I was going to throw you off. I thought you might think they were intercostals, but no, this is serratus anterior. Yes, good job. Good job. All right, final question. You ready? What are the 4 rotator cuff muscles? We spent a little time on this today. So this is the abbreviated. So what are the 4 rotator spinatus muscles called? So everything is a spinatus except for one of them. But what are the 4 rotator spinatus muscles? So we've got the sub, we've got the infra, the teres, the supra. We've got the sub, the infra, the teres major, the supra. The sub, the insta, the teres minor, and the supra. The sub, the infraspinatus fossa, the teres, and the teres minor and supra. Let's see. So let's see. All right, can you eliminate one right away? There's one. Look at the letter C. See how it's throwing you off there? Infra, insta. There's no insta-spinatus rotator cuff. It's infraspinatus rotator cuff, which also gives you a hint that the infraspinatus fossa is not the muscle. It is the location of it. It's the location of the muscle. All right, what do you pick? A, B, or C? I know. That's why we do this. That's why we do this. Susan just said, oh, you got me because I didn't slow down and read. Ooh, I'm liking what I'm seeing here. Boom. A, yes, because it's subscapularis, infraspinatus, teres minor, and supraspinatus. Good job, you guys. Here's a picture of those, the one we used in our class today. So supra, sub, teres, and infra. Good job. Good job. We have reached the end. Yes, and because you've been sitting for like an hour, we're done for today. So you get to go out and do some movement. How do you want to move? Are you going to go for a walk? Are you going to stretch? Are you going to do some yoga? How are you going to move today? Some of you are at work, and that's fine. That's cool. Let's just make sure we've got, yep. All right. So yeah, so good job. I'm going to hang out for a few more minutes to answer any questions, probably for the next 10, 15 minutes. I want to remind you too. Oh, before I do that, I will say my name is Jody Scholes, and I am your instructor for the MBLEx review course. A reminder that in April of 2023, I don't know when you're going to watch this, but in April, we begin our foundations for a successful business class. We're going to start on Thursday, April 6th, I think it is, yeah, April 6th. That's Thursday, April 6th. That's going to be immediately following our MBLEx review class. So we're going to start at 1:30. And I will be spending an hour with you talking about some of the basics of getting started, the foundational stuff, what to put on a business card, how to create a policies and procedures manual, just all of how to hire, how to fire, what is in, how to do social media, like all of these things that I don't know if I had ever shared with you, but that for 14 years, I had a physical location, what they call a brick and mortar location. I just saw you say that, Susan. Yeah, a brick and mortar location, a physical location. So some of you are planning to see clients at their home. Some are going to be a home-based business. That's great. All of this will still apply because even if you're not hiring, you're going to be a sole proprietor. These are all things that apply to being a licensed healthcare professional. Your policies and procedures. What's your 24-hour cancellation policy? How do you enforce it? These are the conversations we're going to have in the business class. Thank you guys for all of the, thank you. Yay, Lauren, you got to attend, yay. Good. Seeing lots of good stuff happening out there. And, yes, I say you're welcome. I see the thank yous, and I thank you. I thank you for making this time to be live with me in class, or to be live sitting in your seat watching the recording. Because what we are holding the vision of, and I can truly say this as a we, what we are holding the vision of, I am holding this for you as well, is that you are taking the MBLEx, you are passing the MBLEx, and you are practicing as a licensed massage therapist. And that starts right here. That starts right here in this classroom, listening to this recording, participating. You have just sent a clear message to the universe by spending your time, your energy, your attention here. The universe knows what you want, and that is to pass the MBLEx. So I'm going to sign off for now. We'll see you again real soon. My name again is Jody Scholes, and I'm your instructor for the MBLEx, instructor and like holding the vision with you during this MBLEx review course. Have a great rest of your day.